On a camping trip, 75-year-old retired machine operator Iluminado Lumi Ruiz began experiencing double vision, a headache, and vomiting. He was rushed to the nearest hospital, where doctors performed an MRI and determined he had had a stroke. Lumi was transferred to Cleveland Clinic main campus, where he was put on a ventilator while doctors worked to stop the bleeding in his brain. More than a month later, Lumi had improved enough to be moved to Regency Hospital, Cleveland West, where his recovery continued. Lumi's care team immediately began working to liberate him from the ventilator and guided him through a series of lung-strengthening exercises until he was strong enough to have his airway support removed. After a month of steady progress, Lumi was ready for the next phase of recovery at Cleveland Clinic Rehabilitation Hospital, Avon. Upon admission, Lumi had left-sided weakness, impaired coordination, speech challenges, and balance issues. Physical therapists worked on getting Lumi up and moving again. They used a standing frame to help improve his posture while using a mirror to provide visual feedback to his brain. Lumi also worked on increasing muscle strength in his leg and left ankle by using a seated stepper. Next, Lumi's therapy team tackled walking. As he got stronger, he took his first steps in the parallel bars. As Lumi was able to increase the number of steps he could take, he began using a standing support walker, which helped offset some of his body weight while he continued to build lower body strength. Once Lumi no longer needed body weight support to walk, he began using a walker and an electrical stimulation device on his left leg to help retrain his brain to use the muscles needed for walking. In occupational therapy, Lumi focused on regaining his independence while performing everyday activities. Therapists had him perform reaching tasks to promote muscle movement, coordination, and left-sided body awareness. Lumi also used an interactive touchscreen with games and assessments to improve hand-eye coordination, reaction time, depth perception, and working memory. One of Lumi's biggest challenges was left-sided spatial neglect, a condition that prevents many stroke survivors from sensing or seeing things on the affected side of their body. It isn't a vision issue, but rather a deficit in perception and attention that Lumi was able to improve through PRISM adaptation therapy. Speech therapists performed a swallow study test, which is a special X-ray that helped identify why Lumi was having trouble swallowing. They then worked to strengthen the muscles in Lumi's mouth and throat by performing swallowing exercises to improve independence with eating. Recreational therapists worked with Lumi on getting back to one of his greatest passions, playing the guitar and other musical instruments. After 3 weeks at Cleveland Clinic Rehabilitation Hospital Avon, Lumi discharged home, where his large family was waiting to celebrate. He looked forward to working around the house, playing guitar, and enjoying his Sunday dinners with family again. Over the next few months, Lumi continued to improve at home. His family assisted him in ongoing therapy activities like walking up the ramp to his home. Lumi was also able to perform exercises independently, such as using resistance bands for increasing arm strength and riding a stationary bike. The best part of all was getting back to spending quality time with his family and making music together. We wish Lumi all the best in his continued recovery.